Epilepsy affects some 2 million people in the United States. It is a serious medical condition. But by working with their doctors, people with epilepsy can carry on with their lives. John lost his sister in 1970 when they were both teenagers. A lot has changed since then. To honor her memory, he urges people to find out about all the treatment options available today.
Become your own advocate. Learn as much as you possibly can about it.
The brain is amazing and complex, the control center of our bodies. When the brain's normal activity is disrupted, however, we can experience a seizure. It's like an electrical storm in the brain.
And of course, a seizure is essentially a symptom. It's a symptom of the brain, what some people call short-circuiting.
While an injury, high fever, or disease can trigger an individual's seizure, epilepsy is an ongoing condition.
It consists of recurrent and unprovoked seizure episodes.
Tamara's epilepsy education began when she was 14. In the middle of the night, she suffered an overwhelming seizure and lost consciousness.
And my best friend, fortunately, was sleeping over that night, heard me fall in the bathroom, and when she found me, she of course got my parents and woke them up.
Her parents called 911. They didn't know what was wrong, but they knew Tamara had experienced something that required immediate medical attention.
So some seizures start all at once in the entire brain, and we call those generalized seizures.
In the past, the term used for a generalized seizure was grand mal. Doctors who specialize in treating epilepsy may refer to it as a tonic-clonic seizure.
And this is the most obvious seizure, the most catastrophic. Oftentimes sudden onset, with or without warning. There may be stiffening, repetitive jerking of the arms and legs, loss of consciousness. There may be abnormal respirations, and the patient may bite the side of their tongue. There may be urinary incontinence. The patient may injure themselves. They may fall on the ground, dislocate their shoulder, strike their head. After the seizure, there's a period of confusion and headache and gradual recovery.
The other sorts of seizures occur as they start as a tiny part of the brain, and they may be so small just to produce a single symptom, like twitching of an arm or a language disturbance.
Tamara now believes she had those smaller seizures for years before the one that sent her to the hospital. They're called focal or partial seizures, and they can be much less obvious. Unless a focal seizure spreads, the only effect might be a brief moment of staring, confusion, language problems, or physical effects. Even leg pain could be a symptom.
The initial diagnosis of epilepsy really is based on the medical history.
Now we're going to put on the first electrode, which is the occipital.
A test called an EEG may add important information as well.
An EEG is a way of looking at the brain waves, the electrical activity in the brain. And like an EKG is used to look at the electrical activity of the heart, an EEG is used to look at the electrical activity of the brain.
But not everyone with epilepsy has an abnormal EEG.
So if we look through here, these are the frontal lobes, these are the temporal lobes. And as we
Another test that may be helpful is an MRI. This test might reveal problems inside the brain that could be causing seizures. Blood tests may be used to look for any possible medical causes, such as infections. An underlying cause might not be found. Even so, having the diagnosis of epilepsy means you can move ahead toward treatment. Although no two patients are identical, and doctors cannot predict exactly how a patient will respond, the goal is always the same.
The goals of treatment are no seizures, no side effects, no lifestyle limitations.
John O'Hurley's sister was diagnosed with epilepsy more than 40 years ago. Back then, options for treatment were more limited.
So managing her seizures was very difficult for her. On and off medications, trying to adjust dosages.
As an advocate for epilepsy awareness, John knows treatments today may reduce or in some cases eliminate seizures. So he urges patients to work closely with their doctors. The most common treatment for epilepsy is medicine. There are more than 20 anti-seizure or anticonvulsant medications. Each one carries the possibility of side effects, so it can take time to find which medicine or combination of medicines is right for you.
Finding the correct medication has been a huge process for me.
By working with her neurologist, Tamara found her way to treatment that controls her seizures without intolerable side effects. So for her, staying on her medication is no problem.
Right now, taking my medication is second nature to me because of how long I've been on it for.
As Tamara says, it's a process. For Lourdes, that process took years. She was diagnosed with epilepsy in 1996. For a long, frustrating time in her life, her seizures were uncontrolled. Often, they would break through even when she was on medication. Lourdes is all too familiar with the fear of knowing a seizure may strike at any moment.
What happens if you're out in public, if you're on public transportation, that you can fall and injure yourself, you're not around your family or someone, so it can be frightening to not have your seizures under control.
As a medical technician herself, Lourdes knows it's essential to work closely with a doctor to find treatment that works effectively for her. That requires good communication. Patients need to find out what to expect from their medication and how it should be taken.
The lack of effective treatment is often because the patient either does not understand the schedule of the medication, is not taking the medication appropriately.
Medication may be ineffective because of other factors, including an incorrect diagnosis, medicine not being matched to the type of seizure, a dosage that is too low, lifestyle factors such as alcohol and drug abuse, or drug interactions. One way to keep track of how your medicine is working is to start a seizure diary.
We know when we ask patients in the office, how are they doing? Many times they base it on their most recent experience, which is the last 2 weeks or 4 weeks. When we look back over a year, we may get a better representation of their effectiveness of therapy.
The more closely you stick with your treatment plan, the better your chances of reducing or eliminating your seizures.
If your medications are working, you're a compliant patient, you keep your appointments, you can have a normal life like everybody else.
For Tamara and Fred, and ultimately for Lourdes, medicine was helpful in reducing their seizures. But for others, surgery might be considered.
We offer surgery to patients who have not responded well to medication. And in those instances, how we define that is a bit variable, but we've arrived at a general consensus that if having tried 2 or 3 different medicines singly, and then perhaps a combination of medicines together, seizures are still disabling, then we'll think about next steps, often surgery.
Patients with uncontrolled seizures might be referred to an epilepsy center, such as this one at the Mayo Clinic. Surgery is considered when the area of the brain where a patient's seizures start can be identified.
The goal is to remove the area of seizure onset. Long-term follow-up studies at a number of institutions, including ours, have indicated that the majority of these patients are seizure-free or near seizure-free after surgery.
For teens and adults whose seizures are not well controlled with medication, a procedure called vagus nerve stimulation might be an option. The large vagus nerve connects parts of the brain to body organs such as the heart and the stomach. Stimulating this nerve has been found to reduce epilepsy seizures in some people by 20 to 40%.
Vagus nerve stimulation is a little bit like a pacemaker, but for the vagus nerve. And the pacemaker is an electrical device that's put in somewhere around here. The wire leads up to the vagus nerve in the neck, and it sends a little electrical current to that nerve, so it reduces the frequency of seizures if adjusted just right.
A special diet may also be considered, one that is high in fats and low in sugars and starch. It's called ketogenic.
And in that one, you're trying to eat foods that will help generate chemicals called ketones in the blood, and those seem to have a calming effect on the brain so that you have fewer seizures.
A less extreme version is called a low glycemic diet, choosing foods that help lower the amount of sugar in the blood. But patients should not try to experiment with special diets on their own.
I think if a patient is going to be on a diet plan for a seizure disorder, this should be discussed with the neurologist.
The first time Lourdes had a seizure, she was asleep. Her husband, Luis, was terrified. Through the years of being treated for seizures, Lourdes has been able to count on her husband's support. Luis goes to the doctor's appointments with her, so he can describe what happens when she has a seizure. The doctor explained how Luis can help.
He asked me to monitor her. If I could, try to monitor, how long the seizure is, how many did she have, and if she had multiple seizures, the time span between each seizure.
And looking at seizures that occur on TV and in movies, we know there's a lot of wrong things we can do. We don't want to restrain the patient. We never want to force anything in their mouth.
Your doctor can give you specific suggestions, but the basic principle is to keep the person safe.
If they're about to fall and you can break their fall, do that. You want to keep them from hitting something. If they are having a lot of muscle movement and flailing and they could hit a piece of furniture, you want to try to move that. You don't want to restrain them. You don't want to constrict them in a lot of ways.
Call 911 if breathing stops, an injury occurs, or if for any reason you feel the situation is out of control. If you know what to do, you can provide effective help in having the seizure. For people whose seizures are not well controlled, it's difficult to plan for the unexpected. Perhaps the most important way to plan ahead for safety is to understand what can bring on a seizure.
I know exactly what a seizure feels like, and I know exactly what brings it on. It's always when I'm either stressed out or overtired or a combination of the two.
The common triggers for seizures are sleep deprivation. Stress is one that's commonly talked about, and then missing or forgetting to take a medication if you're taking it for seizures is another common trigger.
Keeping a diary of seizures can help identify your triggers, and it might help you gain awareness of how your body feels before an attack. You might experience what is called an aura, but it's not the same for everybody. For Tamara, it's a physical symptom.
My leg starts going numb, and I can feel the numbness, so I know that I need to sit myself down and cancel any activities I have for the rest of the day.
But as Fred came to realize, an aura can also be just a feeling that something isn't right. That's why he got off his bike before his second seizure.
Because I was a little disoriented, and I clearly had felt that something was happening.
Oftentimes these auras are very specific to an individual and similar each time, and many times the patient will describe them in their own terminology, but it's usually an unpleasant sensation and occurs prior to the time where they lose awareness.
Not every patient knows that a seizure is about to start because of that aura, but some do, and it can allow them to do something like sit down or even lie down if they know they would otherwise fall during a seizure.
Fred is not only familiar with his type of aura, he also is aware of what might have triggered his seizures. Flashing lights at the airport where his first seizure happened, and flickering sunlight before the second one.
I have to be attentive to the angle of the sun and how much it hits me directly in the eyes.
Both times Fred suffered a seizure in public, strangers came to his aid. If there's a next time, whoever helps him will have more information about what's wrong.
I have an ID bracelet that I got from a medical supply company that has the standard symbol on it and the word epilepsy in the back, which I thought would be the best choice for if I ever did have a seizure again for anyone attending to me, EMTs for example.
If an individual is at high risk of seizures, then it may be very important for them to have information available to someone when they can't speak for themselves, whether this is a bracelet or a card.
There are also ways to add protection by taking a close look at your home and workplace. Put away things that might cause injury during a seizure.
We spend a tremendous amount of time in the kitchen, the bathroom, and the bedroom, and we know there's things we can do to minimize injury, and that's very important.
Creating an environment of awareness and safety is especially important for parents of children with epilepsy. That includes communication with the child's school. Sometimes parents need to educate the educators.
Obviously, they want to be sure that the child has the same educational opportunities or the opportunities that best fit their developmental skills.
It's important that the teacher knows. It's important that the students know in class that this is not something unusual. It's something that happens to some people, and they're able to live with it in management.
Tamara has been able to arrange a school schedule that allows her to get the sleep she needs and minimize stress. She's grateful to her parents for working with her to replace fear with knowledge.
Well, my parents were just as scared as I was at first, and they've helped me cope tremendously.
The history of epilepsy is as old as humanity. Alexander the Great and Julius Caesar were described as having fits or seizures. In the past, seizures were believed to be a sign of demonic possession or some other outside force. Even today, people with this condition often face ignorance, even prejudice.
I think epilepsy still is a disorder that oftentimes there's more ignorance than there is knowledge.
There's a tremendous amount of stigma and a misunderstanding about seizures and epilepsy.
John O'Hurley believes that stigma was a terrible burden for his sister, especially when she had a seizure at school.
And it scares people, and kids can be cruel without meaning to be, but they can be. And so it's a very difficult thing to do, and it's very difficult for her.
That's why he works to get the message out that people with epilepsy can and do live full, active lives.
Many individuals with seizures and epilepsy are as on top of things as any of us, and in many cases more so.
Each individual needs to set his own course with the condition. Since his retirement, Fred no longer commutes to work on his bike, but he still enjoys riding in less stressful settings.
In fact, yesterday I peeled off 25 going on 30 miles in the hills west of Boston.
But each person's situation is different. Recreational activities should be discussed with the doctor.
I usually encourage patients to be physically active. I think common sense, don't swim alone, probably true for most of the people, not just patients with seizures.
It's especially important to talk about driving. No matter how well your seizures are controlled, the decision might be out of your hands.
That's a legal or state decision, and the patient has to abide by the laws in that particular state.
Women with epilepsy have an additional consideration: planning for pregnancy.
When a woman who has epilepsy and is interested in starting a family comes to the office, I try to talk with them a lot about the medications, the impact of medicines on the developing fetus, and try to plan ahead of time.
Another issue to discuss is how epilepsy is affecting your mental health. Coping with a chronic illness poses challenges for both the patient and the caregiver. Don't be shy about asking for help.
There are emotional and or behavioral issues that need attention when somebody has any chronic illness, especially epilepsy. And so I encourage patients and their families to talk about that with their provider, and we try to arrange for help with those issues as they come up.
For Lourdes and Luis, managing epilepsy is a partnership. That makes a big difference in her attitude toward her condition.
And the times that I felt depressed or bad about myself, that I have this label of epileptic, tells me that you just take your medication religiously and you'll just like everyone else. There are people that have to take blood pressure medication, medication for diabetes. This too is manageable.
My advice to somebody who is just diagnosed with epilepsy would be that it's not the end of the world and don't let it scare you.
In pageants and on the air, Tamara is shining a light on epilepsy. Her story raises hope and awareness.
There's a lot more awareness now of epilepsy. A lot of of empowered patients with epilepsy are helping to educate and to improve understanding of epilepsy. That's a very hopeful part of what's happening in epilepsy right now.
So overall, I think the horizon is very positive.
Epilepsy affects millions, but each person's management plan is unique. The key to success is learning what you need to know, working with your healthcare team, and making a positive commitment to your health.
Because management is the key. You can live a very normal, productive life with epilepsy.